Good evening everyone, and thank you for tuning in into our live stream. I'm Fatin Zafira and I'm a caring pharmacist. I hope you guys are enjoying your weekends. Today is the 20th of December, so that means there's only 5 days away to Christmas Day. And Christmas Day calls for a Christmas feast. And for our extra sweet people, diabetes patients, this should be a very good preparation for you so that you can enjoy the Christmas Day mindfully. Of course, we cannot go into our live stream without our expert in diabetes management. Our expert is actually a very experienced field consultant endocrinologist from Hospital Putrajaya. Without further ado, let me welcome Dr. Masni. Hi, Dr. Masni.
Hi, Assalamualaikum. Hi, everyone. I'm Dr. Masni from Hospital Putrajaya. Thank you for having me in this lovely evening.
Hi, Doctor. I was actually just telling our viewers that if diabetes patients don't enjoy their Christmas Day mindfully, they will actually worsen type 1 and type 2 diabetes. So before we go further into this diabetes topic, maybe doctor can explain a little bit on the background of diabetes?
Diabetes, as you mentioned just now, Fatin, consists of mainly type 1 and type 2. Mainly, but there are other types of diabetes. The type 1 diabetes, also known as non-insulin, type 1 diabetes is also known as insulin-dependent diabetes. Why do I say insulin? Because it's autoimmune disease, where it attacks the beta cells. What is beta cells? Beta cells in the pancreas, it produces insulin. This is the place where it produces insulin. So, antibody attacks the beta cells and beta cells can't produce insulin. So basically in type 1 insulin, there's zero insulin, zero or very minute chicken dose of insulin only. So they need, insulin is needed, an hormone that needed for glucose to be transferred from blood vessels to the cells. So without insulin, the blood glucose in your body will be retained only in the blood vessels, not into the cells. So that's type 1. Type 2 diabetes is also previously known as non-insulin dependent, but the major factor is due to insulin resistance and also lack of insulin, not zero insulin, just lack of insulin. There are the factors, the genetic factor, the lifestyle factor also contribute to this type 2 diabetes. Yeah? Type 2 diabetes. So because of that, the blood group, because of lack of exercise, leading to insulin resistance, so becoming lack of insulin. So in the end, patient have high glucose level in the blood. So that's type 2.
Yes, thank you, doctor. So to those our lovely viewers who are unsure what insulin is actually a hormone in the body that helps to break down carbohydrates, proteins and fats, and it also promotes the absorption of sugar into the organs. Doctor, what do you think about the level of awareness regarding diabetes in our society?
There are many studies, Fatin, that has been done. Even in Hospital Putrajaya, we did that small study also. But from papers, from a view, that latest paper is to 2018 that showed that the awareness of diabetes among population is low.
Okay.
It's low. There are lack of awareness. So I guess that's the reason why the prevalence of diabetes is increasing. So why the lack of awareness? So that study point out the lack of knowledge, secondary to the attitude and leading to the attitude problem also. The lack of knowledge leading to the attitude. So from that attitude, and they keep on the lack of exercise, the physical activity from dietary. So it contributes into the population of increased prevalence of diabetes.
I see. Okay.
Definitely lack of knowledge, lack of awareness.
Awareness lah. Alright.
So we need that prevention, yeah?
Yes.
So to implement that awareness, primary prevention to prevent this diabetes prevalence, because diabetes prevalence is definitely increasing.
Yes, doctor. Talking about prevalence, from your experience or maybe from your clinic in the hospital, do you find type 1 or type 2 diabetes is more prevalent?
Type 2 is more common, definitely higher compared to type 1. Type 2 is 90% more. We're seeing it in Malaysia and also besides in clinic hospital. Type 1 is mainly about 5, not even 10%, not even 10%, 5% only type 1.
I see. Okay. So we can summarize to our viewers, actually the most common one is type 2 diabetes, in which it is contributed by the insulin resistance. Correct, doctor?
Yes.
All right. Doctor, do you know maybe in which race or which the diabetes is more prevalent, or any factors that's contributing to this?
Diabetes prevalence has been in Malaysia. Every 5 years now, we have National Health Morbidity Survey every 5 years. So the latest National Health Morbidity Survey is to 2019.
Alright.
It was published early this year.
Okay.
So it showed that the prevalence of diabetes is increasing, as I mentioned earlier. So about 18.3% of our population more than 18 years old are diabetic. So
That
meaning
is the diagnosed one, right?
the diagnosed, yes, diagnosed,
Okay,
right?
yeah.
So 1 in 5 of our population more than 18 years old are diabetic, all right? So if in this room that we're sitting right now, Fatin, if we have 10 of us, so 2 of them will be diabetic.
Oh, wow.
2 of them. So that's not a small number.
Yeah.
Yes, that's not a small number. So that 18.3% is amounted for nearly about 3.9 million of our population. Our population now is about 32 million in Malaysia. So 3.9 million of our population more than 18 years old are diabetic. So the scary part is, that half of that 3.9 million are walking around, half of them are undiagnosed.
Oh,
Undiagnosed.
very scary.
They are only diagnosed during that screening, when they were doing that screening.
Yes.
Half of them are not diagnosed. So my question to you, listeners, and to you, Fatin,
Yes, doctor.
when is the last time you screen yourself? So when was the last time you screen? Okay. So I advocate those listeners, if you have relatives of diabetic, you are more than 30 years old, you are obese, smokers, you have hypertension, please screen yourself. Your next question is, how frequent to screen, doctor? Every 6 months.
Yes.
Every 6 months, please screen. Because late diagnosis, or when you diagnose late, so you come with complications. You become more complicated. You get complications. You come in bad state of the at late stage. So you wouldn't want that. You wouldn't want that. Yeah,
I agree.
right. Okay.
Yes, to our viewers, if you have not known this yet, if you want to do a regular blood glucose monitoring, you can just walk into any caring pharmacy and the pharmacist will be able to assist you. Yeah? All right, doctor. We were
Please
just
do.
talking about the prevalence, right?
Yeah.
So, in Malaysia, we all know we have a wide variety of choices of food because to our diversity of cultures.
Yes.
But if we don't control, it's going to worsen and it's going to increase the complications and whatsoever. So, doctor, what is your opinion on how to manage these complications, and are diet effective? If so, how?
There are your question, Fatin. You talk about complications just now.
Yes, correct.
You talk about the diet, how to control. So that is lifestyle.
Yes.
So when it comes to complications, before I talk about complications, a good glycemic control, a good glucose control is needed to prevent the complications. That's well known. Many studies have been proven multiple times that a good control is needed to prevent complications. So talking about complications, what are diabetic complications? I'm sure a lot of you know. So some of my patients will point out the eye doctor, the kidney doctor. So simply put, the complication of diabetes divided into big vessels complications and small vessels complications. So the big vessels complications are also called macrovascular complications. So the macrovascular complications, the big vessels, consists of these three: the cardiac, the coronary vessels, the cerebral vessels, the brain, and also the vessels that supply the lower limbs, the peripheral vascular disease. So that's the three complications, the big vessel complications. The small vessel complications, there are many. The kidney consists of the eye, retinopathy, the kidney, nephropathy, and also the nerve, neuropathy. right? So the big vessel, macro and microvascular complications. So you need to get good control to prevent those complications, right? So being diabetic, being a obese person with, being a person with diabetes, increase your risk about 2 to 3 times of having heart disease.
Yes.
Despite good control, yeah?
Yeah.
So, heart disease and also stroke. 2 to 4 times higher of dying from those two,
Wow.
heart disease and also stroke. Dying. Having is different. Dying also a problem, alright? Okay. So, amputation rate is every 32nd worldwide person with diabetes, every 32nd will have some kind of amputation. Small toes or big toes complicate or big of the ankle amputation. So due to diabetes. So every 32nd worldwide, yeah, every 32nd, right? Okay. So nephropathy, end-stage kidney disease, So I think most of them will get some kind of kidney, and end-stage kidney disease is half of them in Malaysia. Those on dialysis is due to diabetes, right? 1/3 of patients with diabetes will get retinopathy, the eye complications. So what I'm trying to tell here, my dear listeners, it's not a small number. Those number, it can be prevented. How to prevent it? By having a good control of your sugar, right? Okay. So how to get that good control is that A, B, C, D, E. Oh, A, B, C, D, E. What's A, B, C, D, E, doctor? A is the A1C, that's the sugar control. B is your blood pressure. C is your cholesterol. D is the diet and drugs. E is the exercise. Okay, let me talk about diet first, yeah? The dietary intervention, dietary intervention is important, is the mainstay, of treatment, the dietary intervention. So simply put, when it comes to dietary intervention, you have a balanced diet, carbohydrate about 50%, right? Protein about 20%, and fat about 30%. Balanced diet. Suku-suku separuh is the plate method.
Okay.
So the amount of the carbo that I mentioned just now is the 50%, 30%, and 20%. That's the amount of the nutrient, macronutrient.
Yeah.
The suku-suku separuh is the plate method that to make your life easy. What is the suku-suku separuh? Suku is the carbs. Yeah, it can be coming from your spaghetti, your rice, your bread, right? Another suku or another quarter is the protein. Protein is coming from your tahu, your tempe, your ayam, your meat or your fish, yeah?
Yes.
But the most important that protein is the cooking method.
Yes.
If they use a lot of oil, so that's it, finish your fat there, right? So the half plate method is your fibers, your fruits and your veggie. So why the fiber is so important? So we need 5 exchange of fibers per day. Yeah? It's not easy to get 5 exchanges of fiber. Not easy. 5 exchanges of fiber per day. So that why the fiber is important, because it's flatten your curve, flatten the peak of the glucose. The peak, where the coming from, the glucose is coming from the carbohydrate that you're taking in. The carbohydrate you're taking in, so the fiber will flatten the peak. So we need that fiber, yeah, so that it will be less glycemic index. So I implore of you, all of you, please take lots of fiber. I'm reminding myself also, okay, right? And not to forget, less high calorie dense food. High calorie dense, like sugary ice cream, jelly, cakes. Christmas is coming. So there will be lots of cakes, desserts, cookies. So keep that in mind. That those cookies are high in glycemic index. It will cause your glucose to be peak, yeah, after your meal. So that we will talk about that peak, how to measure your sugar using your glucose here, your glucometer here. In a short, we'll talk that shortly. Right? Okay.
All right, doctor. Just now you mentioned all this can be controlled by diet, right?
Yep.
But with uncontrolled diabetes, it can lead to a lot of other complications, as you mentioned earlier. So, but according to the fifth clinical practice guideline. Aside from medications, diet and lifestyle also contributes to this. So do you have any sharing regarding medications, diabetes medications?
Besides the diet, physical activity, medication is a second line. Yeah? Lifestyle is the mainstay. You have to do these lifestyle changes, and it will be lifelong. The lifestyle, it will be lifelong. Medication is of course needed. It is helpful to reduce your glucose. So these are the medications. There are many medications that can be in the market now that I am using also, such as sulfonylurea, biguanides, insulin, SGLT2 now, DPP4, TZD. So those are the anti-diabetic medications that I am using, or your GPs are using to reduce your blood glucose level. Yeah.
All right, doctor. We have a question from the viewers. When self-measure blood glucose, what precaution do we need to take?
What precaution do we need to take when the good thing about self-monitoring, before doing this glucometer, of course you need to clean your hands first, wash your hands. Okay, you may or may not need even to swab. Just clean your hand and then do the usual the needle, a new needle, put it in and prick and check your glucose. The result will come out within 5 seconds. Within 5 seconds from the glucometer result. Most glucometer results, the result within 5 seconds, you will get the results. Yeah. All right. So, what are the question? What the complications? What are we need to do? Sorry.
One moment. Yeah. All right. What precaution do we need to take? Thanks for your question, Jane Ning. Yeah.
What precautions?
Maybe doctor can explain a little bit, because I get a lot of questions from my customers whether they can use the lancet multiple times.
No, I don't. Please do not use it multiple times, and please do not share your lancet, the used lancet, to someone else. Please do not. Yeah, the lancet is meant to be used only once, because if you use it multiple times, the risk of infection is there. The risk infection. Being a diabetic, if you're poorly controlled, the infection rate is higher. So do not use multiple times and do not share your lancet, the needle. I'm talking about the needle. Yeah? Okay.
Okay, doctor. I have another question from Nur Suhaida Suhod. I'm a GDM mummy last year. Will diabetes comes when I'm growing older?
Good question. Gestational diabetes mellitus is really high. About 1 in 9 pregnancies, having they have glucose. They are diabetic, either GDM or type 2 diabetic. 1 in 9 pregnancies. Yeah. Okay. Having GDM put you on higher risk of having diabetes in the future. Not even as you get older, put you higher risk to get diabetes. Just simply put, study has been done. You will get diabetes at a 50% chance of becoming diabetic in 5 years. Simply put, yeah, that is one. Who was that? Nur Shuhaila.
Yeah.
50% of you becoming diabetic in 5 years. So that is high. That is high risk. So please screen yourself every 6 months now. Okay.
Okay, doctor. The next question from Josephine. How do we know that the diabetes has damaged our nerve? Is it handshaking is a sign of heart problems or nerve damage due to diabetes?
The early signs of nerve complications is pins and needles. You can get numbness. Yeah, all right. From your exam, your doctor will examine you. Your ankle reflexes will be out. Yeah, your joint. So those are the early telltale signs of having complications to the nerve, not tremor. The pins and needles, you may not feel. It can be painful also. Usually it tends to occur at the peripheral, at the distal nerve, which is they call it the stocking and the glove sensation, because around the glove and also along the stocking area. Yeah, all right.
Right, so for our viewers, the pins and needle sensations, most of our locals address it as like semut-semut, rasa semut-semut sakit.
Or kebas-kebas.
Kebas-kebas,
It can be
correct.
painful. Keep that in mind.
Yes.
Yeah.
So all of these things, all of these symptoms, we have to observe from time to time.
Yes.
Right. Another question, again from Josephine. Thank you, Josephine. How to strengthen our insulin resistance for type 2 diabetes?
Oh, I would reword that word. How to reduce the resistance. Because the more resistant to insulin, you need more insulin. So it is not working at the receptor. So it's not good to have high insulin resistance. So the question should be how to reduce the insulin resistance. That is a good question. Good question is cut down the weight. The obese you are, the higher your body weight, the higher the insulin resistance. The more sedentary you are, sedentary meaning lack of exercise, the more resistant you are. So, how to reduce the weight and how to be more physically active? Increase your physical activity. Increase the physical activity by increase your walking, increase the steps, aim the steps to 10,000 steps per day, right? Okay, do brisk walking, do jogging, do swimming, increase your physical activity. That will significantly reduce your insulin resistance. Once the insulin resistance is less, insulin can easily enter the cells and can be glucose can easily enter the cells and can be used. Yeah?
Yes, I agree with you, doctor. So instead of taking the elevator, maybe we can take the stairs instead. So tomorrow when you guys are going back to work, you can take this into practice already. Right, doctor?
Yeah, but they will say, I work from home, doctor. Well, you can walk up and down, go gardening, go gardening to increase the physical activity. Please do. It matters because exercise is the magic bullet for a lot of chronic disease. Chronic disease is not only for diabetes, for hypertension, for cholesterol also. Yeah? Okay.
Okay. Doctor,
Yep.
we all know there are different types of glucometers in the market.
Yeah.
There are different types, different brands, and different functionalities.
Yes.
So, from your point of view, how do we choose these different? How do we choose from these different types available in the market?
Depends, yeah. If this is a type 2 diabetic with elderly, about 60s, so they want something that easy. They may not be IT savvy, so no need to prime, no need to coding. So which is a straightforward glucometer.
Yes.
Okay, which they just on and put it in.
Yes.
Right. That's for if they are IT savvy, they wouldn't mind of those kind of thing. Of course, they would prefer something that is cheap.
Yes.
That's cheap,
definitely.
right? Because the lancet, it costs. The strip, it is costly.
Yes.
One of the barriers that my patients are not checking their glucose is because of the cost. Right? That is one of the biggest barrier. Okay, so the third, if let's say this is easy, when they insert it, the only few bloods needed, so that they will love it very much because some patients do not like to see the blood.
Yes.
They have
I agree.
phobia. They have phobia. So they may not want to see the needle.
Yes.
So the changing the lancet and the needle the pen that supposed to put in the needle should be they can hide the needle. Okay, so those kind of things play a role for choosing the glucometer. And of course for me the most important is the precision, accuracy. So if let's say they prick and the result is out maybe it's not that accurate is compared to the blood glucose venous plasma. So what's the point? I would prefer someone that's a glucometer that's really precise and doesn't differ that much from compared to the venous plasma.
I agree.
So accurate, accurate is the most important for me.
Yes,
Okay.
doctor. Like for example, like we have here is One Touch Select Simple Meter. It's very easy to use and very compact. So it's a lot easier for our patients to carry around. Let's say for example, they have to go visit their family or friends. They can always bring the meter and keep monitoring their blood glucose. Doctor, what do you feel or what do you think about self-monitoring, blood glucose self-monitoring?
Self-monitored blood glucose monitoring, I've been advocating it to do it. I've been advocating to my patients to them to do it because monitoring yourself is important. We need to monitor your own disease. You need to monitor because the disease 90% of job for the glucose management is 90% is you yourself, the person with diabetes. So self-monitoring in any disease is important. Self-monitoring. So self-monitor glucose monitor is important. But that depends on your life, on the patients, on the age, on what other disease that they have. And on the medication that they have. If they are on insulin, it's a must. Yeah, it's a must for my patient to have a glucose monitoring. They have to check their glucose at least once a day. Of course, the standard is if let's say you're on insulin, you have to do it more regularly, or at least 2 to 3 times per day. But if you are on insulin, the most I can say is at least once a day. If you are on glucose, on oral medication, or also despite on lifestyle, even though you are not on any medication for diabetes, you still need to monitor. Okay, because you would want to see the changes of your lifestyle.
Yes,
let's say you have exercise. So you want to see the changes. You can see the weight. You monitor the weight. You see the sugar. Is it coming down or not? Okay, you have control your diet. Less glycemic index. You want to see the effect. So monitoring is important to know the effect of your intervention. Yeah,
I totally agree with you, doctor. Before we go further into diabetes, I would like to remind our lovely viewers that if you answer the question in the comment box below, which is blood sugar higher than 10 millimole per liter 2 hours after eating considered as hyperglycemia? So if you get the answer right, 5 lucky winners will be selected to win our One Touch Select Simple Meter.
Oh,
Yeah. Okay.
come on, give it a try.
Yes. Alright, doctor. We were just talking about blood glucose monitoring. I totally agree with you. Even to my patients in the pharmacies who come to get the diabetic medications, I told them to get a blood glucose meter so they can monitor at home, which is a lot easier.
Yes.
And especially for our caring customers, they can input their values, their blood glucose values into the caring pharmacy application, and the pharmacist can monitor from the back end.
Right.
So yes, when we
interesting.
look at these values, we can actually advise accordingly. So that's very interesting, and an advancement of the technologies these days.
Yes.
Very, very good. All right, doctor. Talking about blood glucose monitoring, right? Can you share a little bit on HbA1c?
HbA1c is, HB stands for hemoglobin. A1c is the glycolated. Yeah. HbA1c is another method besides the glucose monitoring of monitoring of glucose. Yeah. HbA1c is your blood glucose, your glucose that attach to the red blood cells. So they calculated this the percentage of glucose attached to the red cells, and the result comes as A1c. So it comes as A1c. So A1c is another monitoring of glucose. So but it only reflects your glucose average. It reflects the average glucose past 3 months only. Past 3 months. Why 3 months? Because your red blood cells lifespan is only 3 months. Okay, so that's the reason why 3 months. So A1c is average glucose control past 3 months. 50% from the last month, from December and also November. So the 30%, 20% is from November and September. Yeah, October, September. So A1c, it comes in percentage. It does not tell you the up and down of your glucose. Right now, if like glucose is 15 because you just had a biryani, A1c do not reflect that high glucose and do not reflect your low glucose. It just reflect the average control 3 months back. Yeah.
Okay, doctor. So, for example, because A1C reflects the average 3 months, right? The common situation I come across in the pharmacy is that when patients actually before a doctor's appointment, they fasted so that because when they do the glucose test, their blood glucose reading will be low. However, when the doctor checks the A1C, the percentage is high. Yes.
Our patients are intelligent. Our patients are intelligent. They know that the appointment is going. They're going to their klinik kesihatan. They're going to their GP. They're going to see their doctor in a physician in hospital. They take care of themselves within 1 or 2 weeks prior to their visit.
Yes.
But we are cleverer. We are more cleverer than you. A1C reflect your sugar 3 months, so we know that you are how much you are doing. What how's your status for the past 3 months? Yeah. Glucometer result is to show the up and down at that point. A1C 3 months ago. So how much? It's good to control that within that 2 weeks. But we know how naughty you are that 3 months ago. Okay? Alright.
Alright, doctor. Talking about A1C and the blood sugar level, right? What is the target for HbA1c and the blood glucose level, especially for type 2 diabetes patients?
Alright, A1C depends. A1C, if let's say a young type 2 diabetic at you, good quality of life, Fatin, it should be 6.5% and below.
Okay.
5%, newly diagnosed, young, active, good quality of life. If this is an elderly, 65 or 70 years old, elderly, frail, I would keep the A1C 7 to 7.5%. Okay. Someone who is diabetic with a heart disease, so A1C should be 7 to 7.5%. Okay, so A1C should be individualized. Generally, 6.5% and below. Generally. Okay, but look at your patient. If this is elderly, or just had a stroke, 7.5% is fair. 8% also fair. Right? Okay?
Yep.
Individualized. Okay.
What about the blood glucose level?
Alright. So, if you patient the glucose level from the glucometer, so if you are checking, you have a glucometer at home, you are checking your glucose, okay? So, the glucometer can be done multiple times a day, right? So, if let's say you check your pre-meals or fasting early in the morning or pre-lunch or pre-dinner, the target should be 4.4 to 7. Shouldn't be more than 7, right? Okay. Shouldn't be lower than 4.4, right? If you check 2 hours after your meal, right, it should be about 4.4 to 8, right? Should not be more than 8. Or even occasionally you get slightly, occasionally that's fine. You want to indulge yourself in something, occasionally that's fine. You have a cheat day, that's fine. Occasional. Do check your glucose after, when you did some, when you indulge yourself into something, yeah? Do check yourself. Now you know how bad is that food is, right? So that's the one that was showed just now is the frequency of doing it. So dose on insulin, it has to be tighter, to be more frequent. So the rule, the numbers is 4.4 to 7, 4.4 to 8, right?
Yes.
2 hours after. So keep that in mind. Okay.
Alright, doctor. Talking about blood glucose monitoring, right? How do we know when to test our blood glucose levels? Is it before meals or after meals or before bed or after we wake up? Can you explain a little bit?
Depends on what medications that they are on, right? If let's say they are on sulfonylurea such as Dimicron MR, right? They're on glimepiride, they're on glibenclamide. So I advise them to check their glucose early in the morning and also pre-dinner.
Okay.
Pre-dinner. Reasoning is because Dimicron, the usual Dimicron or Dimicron MR, it is advisable to check in the morning and also pre-dinner.
Okay.
You can check at also post-lunch. If they are on insulin, patient on insulin can be multiple. There are many types of insulin. There are the premixed insulin, the short-acting, long-acting insulin. Okay, so if they are on 4 times injections per day, the 3 short-acting and the one long-acting,
Long-acting.
so they have to do 4 times a day.
Okay.
4 times a day of checking their glucose because they want to know that short-acting insulin is sufficient or not sufficient, and the basal, the nighttime insulin, is sufficient or not, right? Because basal insulin controls the glucose in the morning. The bolus insulin or the short-acting insulin, it covers only your meal. So you need to know that insulin is sufficient or not for that meal. Okay? 4 times. But the least that you can do, it is expensive, doctor. Some patients say the least, I'll tell them at least once a day, patient on insulin. Yeah?
Okay, doctor. Before we proceed,
Yep.
let's get to the questions. I have a question from Alex Tan. Thank you, Alex Tan. Can diabetes patient take honey? Some people advise not to take honey.
The question I will ask my patient, what's your A1C? If your A1C is good target, I'd advise honey is only taken usually, not taken most in every meal. So it's usually taken once a day. But honey to put it on waffle, honey on top of your pancakes, no, definitely no, right? Okay, I'm talking about just because some quite a number of patients take it honey as medicine, as a medicine, so that they can feel healthy. So once a day, if your glucose control is okay, A1C is 6.5% and below, yes, I allow. If the A1C is 10%, 9, 10% and above, no, please don't. No honey for you. Honey. Call your wife honey, that's fine, but no honey in your diet. Yeah? No honey in your diet. No. If your sugar is okay, then it's fine. Right? Okay. Honey is used to treat if you have hypoglycemia. If you have hypoglycemia, your glucometer less than 3.8 and below, that is considered hypo, and you use honey to treat that hypoglycemia. It shows how high is the glucose in the honey, right? It shows that how much that glucose in the honey. So honey is only, I can allow when you have hypo, or when your glucose is good target, then it's fine. Only once a day. Okay.
Or when you call your spouse honey.
Yes.
Right, doctor?
Yes.
All right. The next question from Josephine. How to prevent gestational diabetes mellitus during pregnancy?
That's a good question. So the risk of getting GDM is age. BMI. What's BMI? Body mass index. If you are overweight and obese, higher risk of you getting GDM in pregnancy. Age as you get older, if strong family history of, if let's say strong family history is the first degree relative, your parents or your sisters, so high risk of you getting diabetes. That you can't change. You can't change your genetic. But age also is something not you can change. But weight, yes, weight. So reduce your weight to prevent getting GDM in pregnancy. It matters. Weight matters a lot. So get your weight to the normal BMI, to the ideal body weight if you could. But someone who is overweight or obese, they are high risk of getting diabetes or GDM. So I'd advise them to lose weight about 5 to 10% of their weight within the 6 months, before getting pregnant. Okay, that helps to prevent. That really helps to prevent.
Great.
Right.
That's great. I think a lot of our society, they are not really aware that actually weight can contribute to a lot of problems, health problems,
Yes.
right, doctor?
Yes, I would say obesity, overweight, BMI, this is overweight and obesity lah, okay, is the root, the akar of the all problem, right? So get to body weight, get to the normal body weight, reduce. If you're overweight, too much overweight, too obese, at least 5 to 10% weight reduction. It matters. Weight matters. Reduce it 5 to 10%. Yeah?
That's great. All right, doctor. Another question from Shamira, again on gestational diabetes mellitus. Last pregnancy, I have GDM. Is there possibility I can get GDM if I get pregnant again?
Oh yes. Higher chance. Really high risk of getting another GDM in the next pregnancy. Really high. So the moment you're pregnant in the next pregnancy, the moment your UPT is positive, check your glucose. by monitoring here, or screen your blood. Yeah, screen the blood, right? The moment you're UPT positive, screen yourself, right? Because you're high risk of getting another GDM, or you're becoming diabetic already in the next pregnancy. Yes, because that's how high risk you are. Okay, that's how high risk you are. Okay.
All right. Thank you, doctor. All right. Moving on to our next topic. What about, because I always get questions from customers, from my friends and family, they are confused between hyperglycemia and hypoglycemia. Maybe, doctor, you can share a little bit on these two issues?
All right. Hyperglycemia and hypoglycemia, these are the two glucose emergency. Yeah. Hyperglycemic emergencies, there are two, divided into two. The HHS, which is hyperglycemic hyperosmolar state, right? And the other emergency is DKA. DKA is more commoner in type 1. DKA stands for diabetic ketoacidosis, where glucose is high and acid is also high in a type 1. Okay, we move on to the type 2, which is the HSS, hyperglycemic high blood glucose causing high osmolality state, right? So usually this HSS, hyperglycemic state, is triggered by infection, by a stroke, right? By heart attack, or triggered by certain medications. Then usually there is a triggering factor, or you simply stop your medication. After some time, you will get this HSS. You will get. This is when the sugar level is really high. I'm talking about 20s and above, yeah? Okay. Blood glucose really high. It can be as high as 30. It can be as high as 50. It can be as high as 80 millimole.
Wow.
80 millimole. We've seen many occasions. So, glucometer do not detect 80 millimole. The highest that the glucometer can detect is only 30. Depends. Some glucometer 31. Some glucometer is only 32. So, more than 31, it will come out as HI, meaning high already. So you wouldn't know that is 30, or that is 40, or that is 50, or maybe that's 60. So if let's say it's indicated as high, please go to your doctor, right? It can be really high, causing high osmolar. When high osmolar, so it can lead to comatose and death.
Yes.
And death, yeah? Okay, so don't take it lightly. Usually there's a triggering factor. Okay, that's hyperglycemic. So the symptoms, the early symptoms before you get that HSS is you pass out a lot of urine, you feel thirsty, you frequently go to to pass urine, you feel blood, there's a blood vision, you're easily tired because you can't use that glucose in your blood. Yeah, easily tired and maybe postural giddy. Okay, postural giddy. Okay, so that's the early signs. But prior to getting that HSS, right? Okay, so that's hyperglycemia.
Yes.
Hypoglycemia, on the other hand, that's low blood glucose. Okay, so before I move on to the low blood glucose, so in hyperglycemia, I want to stress on the point here the importance of monitoring yourself, check yourself, so you can prevent that HSS. So that's how important is your glucometer, your glucose, yeah, monitoring. Okay, similar to low blood glucose, important to monitor yourself because low blood glucose, that is 3.8 and below, is also important, very important. It's an emergency because glucose is important for your brain, for our brain. Okay, when I'm talking right now to all of you, to the listeners, 90% of my glucose right now is diverted to my brain, yeah, because our
our brain is being
used a lot of glucose, 90%. Okay, I need to think, I need to talk to you, I need to answer a question. Okay, 90%. Okay, so when the blood glucose is 3.8 and below, your body will give you all the signs, the signs and symptoms. Okay, hey, your blood glucose is low, because they want to protect your brain. So what are the signs and symptoms of low blood glucose? Tremorless, right? Okay. Palpitations, meaning your heart beating very fast. Cold sweats. This is not the sweats during the hot weather. This is cold sweats. You feel cold clammy, cold clammy. You get giddy, blurred vision. You will know all those words in front of on your the screen from your handphone will be blurred. Yeah, you may feel a bit giddy or may feel a bit nauseated, right? So those are the telltale signs of low blood glucose. Please check your glucose. Please check your glucose. If it's 3.8 and below, treat yourself because it is an emergency. How to treat yourself when its glucose is low? Let's come the honey. Yeah, Alex? Yeah? Alex asked about the honey just now. Okay, let's come the honey. So 1 tablespoon of honey to increase your blood glucose, right? Okay, if let's say the sachet, the white glucose, usually at the hotel, you need 3 sachet of that white glucose. Or, right, if let's say you have a Coca-Cola, half of Coca-Cola. I'm not talking about diet Coke, yeah? This is the usual Coca-Cola to treat your hypoglycemia. Half of that can, right? Or maybe 3 sweets, yeah? The sweets that you have, the Hudson's, whatever sweets, you need about 3 sweets to reverse your hypoglycemia. So after that 3 sweets, you need to check your glucose again after 50 minutes when you have hypoglycemia, right? Okay, so that's the importance of monitoring, right?
Okay, doctor. When you shared about the signs and symptoms of hyperglycemia and hypoglycemia, I could actually see it's pretty similar to each other. So what is that one symptom that you can share to our viewers out there that maybe they know, oh, this is hypo or maybe this is hyper? No, just through blood glucose monitoring.
The symptoms are there that I mentioned just now. The hyperglycemia, the weight loss, the frequent urination, and the hypo these are 2 extreme. They are different. They're 2 extreme, high and low. And low will have different symptoms. So they need to be alert of the telltale signs of the low and high blood glucose. And at the same time, good and smart, good to check this regularly to avoid that complications, to avoid the high and the low blood glucose. Yeah,
I totally agree with you, doctor, especially for my customers, patients, and lovely friends and viewers out there. So always people come and tell me, oh, I don't want to do the monitoring, it's so painful, it's so costly. But because they do not know the importance of self-monitoring, it's really, really important.
The importance can be, you can avoid the complications.
Yes, exactly. All right, doctor. Moving on to the questions we have from our viewers here. From Mei Wong, do we have to fast 12 hours before we go to the pharmacy for the blood glucose screening?
No. Or not even 12 hours, 8 hours.
Okay.
8 hours only. So it's okay. You can eat prior to that. 8 hours only, my dear.
Okay. All right, doctor. Maybe since we're on this topic, right? Maybe, doctor, you can explain a little bit to our lovely viewers why do we need to fast before we take a blood glucose test?
That's mainly to check your fasting glucose only. Fasting glucose only. Okay. That's for screening. Okay. You can. You don't even have to fast also if you check the blood over here. That is the A1C. A1C is also can be used to diagnose diabetes. A1C have to be more than 6.3%. Then if let's say your A1C, HbA1c is 6.3% and above, you are diabetic. Okay. If let's say you check your sugar, this is just a screen. You need a venous plasma to confirm that you're for a screening to confirm you're diabetic or no, you're not diabetic. For venous plasma, it should be more than 7.1, fasting blood glucose. And some doctors do advise to take oral glucose, oral glucose, 75 gram oral glucose, and check the blood 2 hours after. If the blood glucose 11.1 millimole and above, you are diabetic already. So 7 and 11.1, you're diabetic already. So this is just a screening. So if let's say your glucose is 7 or 8 when you come, you fasted 8 hours, you come to carrying pharmacy, they check your glucose in the morning at that point is 8. So the next step is check the venous blood. So check the venous blood, so they will do the fasting, proper fasting, and also they may plus minus to check your 2 hours after also. Right? Okay?
Alright, doctor. The next question will be very relevant to your industry because as a consultant endocrinologist, you may know this. Alright, a question from Dr Masni. May I know the latest guideline for insulin self-titration? How many days of SMBG should patient do before adjusting the dose?
This is usually we advise a patient, but depends, yeah, depends on what kind of insulin you get. You get a short acting, you got a long acting or the basal insulin, right? Usually as a start, I start a simple insulin first, once a day injection, once a day, because starting 3 or 4 injections per day, it can be a bit overwhelmed for patients. So most of the time I start with 1 injections per day, and that 1 injections per day is usually the basal or the night insulin, right? If you get a night or basal insulin, such as Insuletat, Insugen N, or Insuman R, or Glargine, or Levemir, yeah? If you get that insulin, you have to check your glucose early in the morning, pre-breakfast, 3 days consecutively, then adjust your fasting, your insulin, right? Usually, we will start a small dose first. We will start small dose, and the patient responsibility to check the glucose and to increase the insulin dose, right? To increase the insulin dose after 3 consecutive days. So the pre-meals, the pre-breakfast, if it's not to target, they have to increase it. So I mentioned the target, the pre-breakfast, it should be 4.4 to 7. If you do not get that 4 to 7, you get maybe that morning you get 10. The next day you get 11.1. The next day you get 9.8. So you need to increase your insulin. Usually we increase by chicken dose also, by 2 units. You increase it slowly. Every 3 days, you need to increase your insulin dose until you get your pre-breakfast target within 4.4 to 7. Alright?
Yes.
Okay. I hope that helped to answer your question, right?
So from Dr. Mas' answer just now, we all can see how important it is
The glucose monitoring. Yes.
Yes. All right, moving on to the next question.
I can't stress it more. It's important.
It's very, very
Yes.
important. Doctor have repeated it so many times. All right, moving on to the next question, yeah, doctor. From Mr. Sindu Subramaniam. Doctor, how do I know I'm pre-diabetic or diabetic?
Right. Pre-diabetic or diabetic, okay, first you need to screen, okay. If let's say your glucose is definitely out of the range, I mentioned earlier, pre-breakfast is more than 7, okay. You need to do venous plasma, Mr. Sindu, definitely you need to do venous plasma. Okay, preferably, since you asked about pre-diabetic, you need to do oral glucose tolerance test. Okay, how to do this oral glucose tolerance test? Okay, you need to fast yourself 8 hours prior to coming to see your doctor. Okay, then take 2 blood. One is at fasting, another one is after you consume that 75 gram of glucose. Take the blood after 2 hours. So if the blood is within before fasting is normal or high, so if let's say it's high more than 7 already, that's diabetic, right? If your sugar, your blood glucose is within normal, less than 7, so that is considered, if 6 to 7, that's impact fasting. That's pre-diabetic already. If let's say 2 hours after glucose, the result is between 7.8 to 11, that's pre-diabetic also. So that's 2 conditions that we call pre-diabetic. Okay, when your fasting is 6 to 7, right? When you take your, okay, and after 2 hour glucose, your glucose 2 hours is 7.8 to 11. So that's pre-diabetic. Why pre-diabetic is important? Because study has been done, pre-diabetic is higher risk of getting cardiovascular and stroke also. Not even diabetic. Even though you're not diabetic, pre-diabetic put you on higher risk also of getting cardiovascular and also stroke. Yeah, the risk is already there even though you are diabetic. Okay.
Thank you, doctor, for the explanation. Again, from another question from Miss Sindhu. Doctor, is there any long-term or short-term complications of insulin? Thank you, doctor.
Short term is, let's say, if you give too much insulin, hypoglycemia. The hypoglycemia. That's the reason why you need to monitor. Okay? That's the reason, okay? That's a short term. The long term, not much. No. It's just that weight gain only. Insulin cause a bit of weight gain. Right? So, that's the one side effect that most of my patients, especially the ladies, do not want that side effect. But there are now other usually I use insulin with concurrent with other medications, oral medications, oral anti-diabetic medications to help that weight gain. Yeah, to reduce that weight gain. Okay, all right.
Okay, doctor. Our last question from our lovely viewers today from Wen Mu. Doctor, can we change the dosage of the medicine every day depend on the glucose level?
If you are on insulin medication, you are allowed to do that with one condition. You have to check your glucose. Yeah, you've done the glucose, this is fine, okay? Okay, you want to adjust insulin, that's fine. But with the glucose monitoring, you want to adjust oral, it's not advisable. Not advisable. Oral medication is for your doctor to help to adjust. Yeah? Okay?
Alright, thank you so much, doctor. Okay, doctor, I think
Thank you very much.
we have a very lengthy and very informative discussion today. Before we wrap up the session, do you have any advice for our lovely viewers?
My take-home message is that take care of yourself. Yeah, take care. If let's say you are diabetic, monitoring is very important. Lifestyle changes. Control your diet. Okay, less calorie-dense food, more fiber in your food. Increase of physical activity. Yeah, increase of physical activity. And last but not least, I want to wish every one of you Merry Christmas. But control your diet. Okay.
Thank you so much, Doctor.
Thanks,
Today's session, I've learned a lot from our discussion.
Yeah.
And to our lovely viewers, as advised by Dr. Mas, always remember to control your diet because it's the contribution to a lot of other diseases and complications. Thank you so much for tuning in, everyone. But please remember to answer the question earlier. Is blood sugar level higher than 10 millimole per liter 2 hours after eating considered as hyperglycemia? The answer is either yes or no. No in between. Alright, so if you are the lucky winner, you'll be able to get the meter for free. Alright, bye.
Bye. Take care.